Well, good afternoon, everyone, and welcome to the fourth of our weekly COVID panel discussions with key community leaders. This is an event organized by Tallahassee Memorial Healthcare and reflects amazing cooperation and collaboration over the entire Leon County healthcare spectrum. It includes TMH, Capital Regional Medical Center, the Leon County Health Department, Leon County Government, Bond Community Health Center, and the Neighborhood Medical Center. And I'd like to recognize our partner, the Village Square. Those folks continue to promote civil discussion all across our community. They will not be posting this live. You can see it later on the Village Square Facebook page. And special thanks to Partners in Communication, which will have a sign language interpreter translating everything we see today. You see Rebecca over there in the corner. And finally, a special welcome to our radio audience on WFSU Radio. For those of you who want to see this, to hear this again, it will be on WFSU Monday night at 6:30, Monday night at 6:30 p.m. On WFSU. You can catch the entire webinar. I'm Gary Jordan. I'm president of the Zachary Group, a media communications company. I host the CBS television program, The Usual Suspects, and I'm here pinch hitting for Skip Foster today, who couldn't be here. So we're not making a change. We're just digressing a little bit. Skip will be back here next week. And I'm sure after today, you'll be thrilled that he is. Before we start, if you missed the first three webinars, you can find recordings of them as well as a comprehensive fact document, which is continuously updated. So all the latest information is on this fact document, as well as the other three webinars. You can find it all at tmh.org/coronavirus, tmh.org/coronavirus. I really encourage you to visit there because everything you need to know is there. And feel free, we'll be trying to answer as many of your questions as possible today. We'll get to as many as we can. We'll do our best. We want to hear from the experts in the healthcare community all around. I see the mayor has joined us as well. Mr. Mayor, hello, sir. Nice to have you here. And but before we do all that, the special focus today is on the vaccine and its impact in the African-American community. And I think it is a critical issue that has been being discussed across this country. Today, we have a special guest to have that discussion. I'm going to spend the first 10 minutes or so with our special guest, and then we'll get to the other members of our panel to kind of update us on the latest that's happening. And I'm thrilled that Dr. Elaine Bryant can join us, former Tallahassee City Commissioner and CEO of E.W. Bryant and Associates, and a good friend. And Commissioner, thank you for taking the time today to be with us. We really appreciate it.
Thank you, Gary. So glad to be here.
So let's get right to us. On past webinars, there have been discussions about the reluctance of some African Americans to receive vaccines. Can you tell us from your perspective kind of where that hesitancy comes from?
Well, yes, let me start by saying that anything I say right now is probably repetitious and you've heard it before, but I'm going to say it again. If we go back to probably early 1900s, 1931, 32, and it really wasn't resolved until later, close to 72, there was an experiment and is now infamous as the Tuskegee study. I won't go through the details, but suffice it to say that that study in and of itself, as people become more and more aware, who may not obviously have been around during that time, but history provides all the details of what actually happened that really denigrated the trust of African Americans as it relates to the healthcare system. Then not only the Tuskegee incident, but we also think very critically about Henrietta Lacks and what happened in that incident that took years before it was even revealed what had actually happened to her. So I don't want to dwell too much on what happened 30, 40 years ago, because the reality is it may not be that, but it continues to happen today. That there are still inequities in the healthcare system. And as we look at this coronavirus and what is happening in the United States, in the state of Florida, and even here in Tallahassee, Florida, we're all challenged with how do we, in fact, inform? How do we, in fact, encourage such that people can make up their own minds about taking the vaccine? Because obviously it's a personal decision. Mm-hmm. But my challenge is to ensure that those decisions are based on fact, things that are not gendered up through social media. I've read so many articles about how people have actually talked about a fact on social media, and the response has been a cartoon or something that says it's not true. So Gary, back to your question, let me just say that hesitancy in the case of African Americans, you really can consider as a normal reaction to the lack of trust.
Rolling trust into the equation, how do you separate that from what is a rollout that is still being designed in process? I mean, how do you separate those two things? Is it simply the reluctance, or is a big part of it how we're trying to figure out how to get vaccines into that community?
Well, I think it's a combination of both. In fact, no question, it's a combination of both. But I think that we have to have targeted efforts in order to ensure that African Americans and persons that are in disadvantaged communities, people who live in rural areas that may not be a part of the mainstream in our city, have very specific targeted efforts to actually reach them, to share the information. I tell people all the time that one size does not fit all. We really have to be very specific, and social media is great, but it's only great if I use it. The newspaper is great, but if I don't read it, oh well. So when we start to think about the various challenges that exist in the African American community and the digital divide, that actually when we start to talk about get online and get your appointment, that I'm wondering how in the world do I get online when I have no access to a computer? These are all challenges that are real, and that we have to have a very focused effort in order to actually ensure that we move in a very positive direction. Herein lies the reason we actually established the task force. But go ahead, Gary, you were going to say.
Well, no, eventually I'm going to pose this same question to Janae and Temple as we move forward. And I'm not trying to make a political statement here, but the public's rollout was announced in our community at the beginning of this week. I'm making a geographical statement. There is no Publix in certain areas of this community and in the areas that we're talking about. There is neighborhood, there is bond, but there is no Publix. Talk about that a little bit from your perspective.
Yes, not only are there no Publix, but there are no Walmarts either. I think that was another site that's available. And I have challenged many people when they say to me, well, you can get on, you have a free ride on the bus right now to get to Publix. Remember, Publix is not anywhere that many African Americans shop. And because of that, it does not lend itself to being what we call a trusted site. So we believe that you have trusted voices, you have trusted sites, and you really have trusted information. So Publix is good. I want everyone, let me just say that, to get a shot. I want everybody in Tallahassee, in the United States, wherever, to get the vaccine. But I want to focus in on the fact that I have heard from many medical experts that we need to reach 70% or somewhere in that area of herd in order for this to be effective. So if African Americans are not included in that number, we're not going to get there as a state and as a city and as a nation. So I'm glad we have Publix now offering and Walgreens and CVS, but I promise you that the number of African Americans who frequent Publix that are not in their neighborhoods is very small. Now, if you ask me if I have any statistical data, I'll tell you no quickly, but I'm willing to bet that that's the case.
No, I think I'm seeing nods all across in every frame of this webinar that that's absolutely accurate. And I think we know that to be true. You know, one of the things I learned over the years, especially in my time in public office, and I know you have as well, that there are some opportunities in crisis, because crisis oftentimes reveals things that we may not have seen before.
Hmm?
In the spirit of that question, talk a little bit about what has been revealed about healthcare in the African American community beyond COVID. I mean, what has been revealed through this that may have gone unnoticed before?
Well, let me start by saying, Gary, I don't know if it has gone unnoticed. It may have gone no one actually did anything about it, but I don't think it's because people did not notice. But healthcare inequities have existed for some time, not only with the availability of healthcare in neighborhoods. We often talk about food deserts. Well, guess what? There's a healthcare desert, just like there's a transportation desert, and there are job deserts. So this is not something that is just happening because of COVID, but it has brought to light the many inequities that exist in the American culture that has in many ways disenfranchised African Americans.
I think, and thank you for sort of clarifying. I think that when I said unnoticed, I meant by the larger community. That oftentimes that is the case when
Right.
it comes to, and I think what I'm hearing you say is that also results in the lack of available resources put over in the communities where the need may be the greatest.
Absolutely. No question about that.
Okay, thank you. Inviting you to stay with us. I'm going to start going around to the rest of the panel now and kind of getting some updates. I'll introduce everybody as we get to you, and we'll start with my friend Claudia Blackburn, the health officer for the Florida Department of Health here in Leon County. They have done a remarkable job. Hello, Claudia. Nice to see you. If you could give us the one or two statistical trends over the last week that kind of jump out to you, that would, I think the folks would appreciate that.
Sure. Well, the good news is we are seeing a decline in our positivity rate and our average number of cases each day. Our positivity rate for the last 2 weeks has been 5.23%, and we're seeing about 122 cases per day. Now, that said, we have had 3 cases of the UK variant here, which may explain why we have this continued high number of cases. And we're also monitoring closely for a surge after the Super Bowl. If that's going to happen, we'll start seeing it pretty soon. We're also seeing cases that are disproportionately in the 18 to 24 year age group. About 30% of our cases are in that age group for the last couple of weeks versus 17% of the population that age group occupies. And then just one last thing, we're on this quest to vaccinate 80%, as Dr. Bryant said, of all people 65 and over. And right now we're at 63%. And we have our partners to thank for that. A special shout out to FSU this week for helping us work through our list of 16,000 people. And now working on the new list of people registered in Sharecare. So we're making progress on all fronts. And we hope that those numbers, the case numbers, keep going down.
Thanks. I want to bring in the 2 people that I talked about a little bit earlier. If you guys would unmute your audio, Temple and Janae. I'll start with Janae Freeman, the Chief Executive Officer at Neighborhood Medical Center. Both Bond and Neighborhood are in the heart of the communities where service is critically needed. Janae, what are you seeing over at Neighborhood?
Well, I definitely want to start by saying the inequities that Dr. Bryant mentioned, that's what we do. That's our specialty as a federally qualified health center. We respond to the inequities that have been mentioned, and it goes beyond COVID, as you mentioned, hypertension, diabetes. These are all things that exacerbate this disease that we're facing right now. So at Neighborhood right now, our focus is education. We're taking advantage of when we actually get people here at our health center who are coming for vaccines, who are coming for regular primary care visits, and educating them about the importance of taking this vaccine. Each day, I think I'm spending probably about 3 or 4 hours educating people about the vaccine. People are contacting our health center, contacting me personally, because they trust Neighborhood and they want our valued opinion about it. So we're here to educate and also vaccinate.
Dr. Temple Robinson is the CEO at Bond Community Health Center. Hello, my friend.
Good morning, everyone. Education is the key. You asked a question earlier about what else good has come out of this crisis. And because Bond and Neighborhood have been on the front row of this, a lot of people are finding out about us that never knew what we did or how we did it or where we were even located. So this has been really good for us to be able to spread our mission and to spread our work. I was very pleased this week that I actually got a call from the Tallahassee Housing Authority because the 65-year-old residents want someone to come with a mobile unit to vaccinate them. So I said, yes, this education is working. We will be doing second vaccines very soon at the Miracle Hill Village Assisted Living Facility. So yes, we went to Westminster Gardens, which is predominantly white population living there, over 65, but we were able to go to the Miracle Hill Village assisted living facility. So we've got to keep pushing to get the word out. People always say, I heard someone say, seeing is believing, but I think now that the data's out there, believing, people are now able to actually see the problem. And we're hoping that more people will see the problem and say, you know what, we need Neighborhood to go here if they could. We need Bond to go here if they could. The rate limiting step to all of this, of course, is vaccine supply.
Janae, let me come back to you for just a second, and I'm going to stay with you for just a second because of the nature of the discussion today. Who is showing up? And Temple, I'd like to hear the same answer from you. Who is showing up who's not in the age group that is ready to go? I mean, are you getting people coming to Neighborhood and to Bond saying, I want this, I'm ready, but they haven't followed, they're under 65 or they're not in the right categories yet, Janae?
Definitely. We're seeing just about everybody you can imagine showing up at our doorsteps every day asking, when can I get the vaccine? Have you heard when we'll be able to get it? You know, that's the number one, that's the pressing question I think everybody wants to know. When can I get the vaccine? We have parents who are coming with their teenage children who are 16, you know, usually around 16, adolescents, asking when they can get the vaccine. We have patients who are cancer patients that have been asking when can they get the vaccine. And I know we're moving toward that now, but you know, when we first started this, that was what we were seeing. People who are immunocompromised, people, especially a large number of caregivers for people who are over the age of 65 are coming because they're spending their days and nights with all of these vulnerable people and they want to be as safe as they possibly can. So we're catching it from all aspects, Gary.
Temple, you experiencing the same things?
Same thing. And when you say a healthcare worker, it's very hard to define sometimes. And so we are threading the needle very carefully because we don't want to get crossed up with the Secretary of Health or the governor. But if the mother is bedridden and the 60-year-old daughter is changing the G-tube, she's a healthcare worker. So we're just being very careful, but we have to use some common sense. The other thing we're seeing is around 4:30, 5 o'clock, 5:30, odd cars start showing up at the health center because these are people that are waiting to see if at the end of a clinic day, if we've drawn up 10 or 11 syringes in a vial, that it might be one shot left and we don't want to waste any vaccine, and can they get it? This has been just very interesting what we're doing, and the rules keep changing. So every day I wake up and poor Dean Watson, I'll text him and say, hey, did they say we could do this yet? And he's like, I don't know, go read the book like I'm reading the book. But this has been very odd what we're doing, but it's working.
Let me go to Dr. Andrea Friall and Trey Blake, because I'm watching both their head nods big time as they're hearing this. Dr. Friall is the Chief Medical Officer at Tallahassee Memorial Healthcare, and Dr. Trey Blake, the Chief Medical Officer at Capital Regional Medical Center. Trey, let's start with you. I'm watching your head nod as you're hearing these things. What's going through your head?
Yeah, we're seeing the same thing. Defining healthcare worker is quite a challenge. We also are using a lot of common sense, but trying to walk a pretty fine line. But I agree with all of that. And I also agree, we also have people showing up at the end of our vaccination clinics, hanging out, kind of working the lobby. So we all are facing very, very common challenges.
Dr. Friall?
Absolutely. We are, as the rollout has become a little more steady and the reliability of vaccine has become a little more steady. In addition, it does help us, and you do see people kind of lining up ready to get those vaccines. And, just as just a good community partner, we're just using our common sense and trying to do the right thing for all the patients in the community. And hats off to neighborhood and Temple. And you just have to use good common sense. You don't want to waste any vaccine at all. And hopefully, as we continue with more rollout, we'll be able to touch more and more people. And that becomes important because our ultimate goal is to get people vaccinated so that, again, we're on the hospital side now. We want to reduce hospitalizations, and we've seen the trends, especially after big events, holidays, et cetera. We had hospitalizations we typically over 50 persons inpatient, which was a big number for us. And coming down now, we're coming off of that hump after the holidays, and we're in the 20s, and our doctors and nurses and staff are getting a break and a breather. I do feel for Tampa. Let's see what happens down there. But so it's really important to get that herd immunity going and get vaccines in arms so that we can reduce the hospitalizations, so that we reduce our morbidity and mortality, especially for our very vulnerable African-American population.
Dr. Blake, give me a kind of a snapshot of what you're seeing at CMRMC.
Sure. Yeah, happy to announce our hospitalizations continue to trend down. We currently only have 34 patients in the hospital. We had a high of 87. We currently only have 3 patients in the ICU, but all 3 are on ventilators. So our trends match the community trends. We are seeing steady decrease in hospitalizations and in ICU use.
Dr. Friall, same kind of?
Same trend, yes, sir.
Let me go now to Claudia Blackburn. Claudia is the health officer of the Florida Department of Health here in Leon County. Claudia, when you hear those diminishing trends, what does that say to you as you sort of try and lay out the whole program?
Well, it says to me that we're coming off an extreme high, a big surge after the December holidays. And we hope that it continues, but we've seen this before, and then it takes another holiday and we're back where we started. We're hoping that the vaccination rollout is going to impact the number of cases, but right now it will impact the number of cases just for healthcare workers that are vaccinated and for people 65 and over. We have a large population of people that aren't yet vaccinated. We've got this B variant present, and people need to continue to wear masks. And now there's information about the effectiveness of double masking and social distancing and avoiding crowds and washing their hands.
Can you talk about double masking for just a second?
Well, I've been trying to understand it myself a little bit better. On the CDC website is a description of what it means, but they talk about surgical masks covered by a face mask, a cloth mask, and in a way to fold the surgical mask so that there's not a lot of space between the face and the mask, and then covering it tightly with a cloth mask. And doing that really reduces transmission and the amount of COVID virus that can get to the person that's masked. If both the person that's masked and the person that person is talking to is double masked, it's highly effective. But right now, if people just wear one mask and they wear it properly and cover their nose and mouth and it's tightly fitted, we're happy about that.
Just real quickly, about 15 seconds apiece, if Dr. Blake and Dr. Friall, if you could just give us your impression of sort of the double mask discussion.
Yeah, I agree completely. The real caveat is the double mask improves the fit of the first mask, and it's only for certain types of mask. But if you wear a cloth mask over a level 1 surgical mask, it is very, very effective.
Dr. Friall?
Absolutely. Not much to add to that statement. The goal is to keep a tight fit or close over your nose and mouth such that you won't be able to exchange the air or particles that way.
Let me pivot to Kevin Peters. Kevin is the Director of Emergency Management for Leon County. Could you give us kind of an update, Kevin, on the county's response to all this?
Yeah, hey, thank you, Gary. Some of the things that we've been doing here from the Emergency Operations Center, we continue our operational coordination calls with many of the partners that we have here today, especially Claudia Blackburn and our healthcare providers. We also are participating in our state emergency operations center calls with the state's EOC. We continue to assist some of our healthcare partners with some PPE needs they may have from time to time. For the most part, the supply chains are back, but there are days where some of our partners need a little bit of assistance. They might be between shipments or what have you, so we've been able to continue to supply to our partners as well as our library system. Our volunteer center, Volunteer Leon, we continue through that office to connect seniors with vaccine appointments that need transportation. You can call Volunteer Leon at 606-1970, and they can help facilitate that linkage of transportation to seniors in need. Again, that's in addition to the Star Metro option you mentioned earlier. Our community relations team, they're continuing to support with messaging to encourage trust and dispel myths about the vaccine process. We're amplifying the national public health guidance that's out there. And testing is still an important thing. We're partnering with Neighborhood Medical Center to do a drive-through testing site on Sunday, the 21st of February at the Northeast Branch Library. That'd be a 2 p.m. to 5 p.m. operation. And then North Florida Medical Centers will also be doing a drive-through testing center on Monday, February 22nd at our Woodville Community Center. That'd be a 1 p.m. to 3 p.m.
Kevin, I'm going to ask you, because that's valuable information, I'm going to ask you to pause for just seconds. We have to say goodbye to our WFSU radio audience. And thank you. Remember, 6:30 Monday. So we'll say goodbye to that audience, and we're going to stay here. We got about a number of questions I want to try and get to. Just pause for a second. Okay, for those of you who are still with us, Kevin, that was pretty valuable information. Will you give that phone number one more time, the 606 number?
Yes, sir. That would be Volunteer Leon. They can help seniors get connected with transportation to get to their vaccine appointments. Obviously, 850 area code here, local. It's 606-1970.
Okay, so all that information that you heard from Kevin, and frankly, everything we're discussing here, let me remind you again, tmh.org/coronavirus. Let me try and get to some of these questions, and I'll be directing them to pretty much all of you. These are from people just listening, and there's a whole slew of them. Once people get the second dose of the vaccine, say 95% efficacy has been reached, should people still not go out in public places with masks, of course? I mean, help us understand what getting the shots means in terms of each of our sort of personal conduct. Let's start with Dr. Friall.
Sure. Adding the vaccine is adding an added layer of protection, but we still have to continue to mask, socially distance, and be responsible. The vaccine protects you from 95% efficacy from contracting the virus. But it does not mean that you still, if you have vaccine on your hands, or you can't pass it around. So hand washing, socially distancing, and mask wearing is still appropriate. And remember, 95% efficacy also, if you were to still contract the coronavirus, your symptoms would be milder, perhaps not ending you up in the hospital. So vaccination is another shield that we have, but it's not right now a tool that makes us not able to pass the virus around in the population.
Dr. Blake, I guess you would agree that getting vaccinated is not a ticket on the irresponsible bus?
Agreed completely. We still have to social distance and wear the mask. We don't know if we can still transmit it to other people. And unfortunately, as we've all just discussed, there are a lot of people in our community that have not got the opportunity to get the vaccine. So wearing a mask is about protecting your friends, your family, and your community.
Actually, thank you for bringing that. It's a huge point that I want to talk to Claudia about. First of all, we just got a note from Loran Osley, our senator. I believe Volunteer Leon can also help those over 65 with disabilities get to vaccinations. So it's important for you folks to know that. Claudia, let me ask you a really important question. A lot of folks have been kind of trying to figure out what percentage of the over 65 population needs to get vaccinated before we can open it up to folks under 65. I mean, there's a certain percentage of folks who are not going to get vaccinated by choice. So what is that fulcrum point where you guys decide it's time to do it? Or is that a decision that's made locally?
That is not a decision that's made locally. That's really a decision that's made by the governor and by people at a higher level. However, we at this point, TMH has received 1,000 doses for vulnerable people, and they are working with the doctors in the community using very strict criteria to prioritize those folks. And I don't mean to speak for you, Dr. Friall. If you'd rather talk about this, that would be fine.
Oh, sure, Claudia, thank you. So just to answer your question, yes, that we have actually started to move to the vulnerable population. So not only 65 and older, but we don't make the criteria for the vulnerable population. That list is given to us. We were afforded, and people will also not just TMH, but you'll be getting vaccines that you can use this list to help identify those patients that meet the vulnerable population. So we have started to do that with our physician partners, and we've created that list, given out the vaccines for that vulnerable population, and then they go through, identify patients that meet those criteria, and they're able to vaccinate until the vaccine's gone and we get more.
I want to, Mayor Daley, can you hear us? Are you still there? I see you're still on screen.
Still here.
Thank you. Hello, sir. Nice to see you. This question came, and I think it's probably most relevant for you. A couple of weeks ago, we were in College Town, restaurant and bars, vast majority young adults without masks, no social distancing, kind of some of the conduct that we had seen before. When I know folks are asking what can be done about that, but I know it's a kind of a frustration that you guys and at the city level wrestle with as well.
Well, it is a huge frustration, and I every time I possibly can plead with our business owners, our bar and restaurant owners, especially those that cater to the college community and the younger set that have these big night concerts. It's not appropriate right now. These are super spreader events. I encourage everyone to step up to the plate and to be good community partners. You know, when we see these viral videos that literally are in the media all over the place with, you know, couple of hundred students or 1,000 students, at a club, it's inappropriate. The problem, Gary, is we can't enforce it. The governor's office has taken the measures to preempt local government's abilities to enforce specific actions due to COVID. So I, as mayor, continue to make the plea. Let's all do our part as individuals, social distance, wear our masks. Let's be smart. Let's be safe. To our business owners, be good community partners as well.
Dr. Bryant,
It is frustrating though, Gary, to say the least.
appreciate it. Dr. Bryant, love to get your comment on that.
Did you call on me, Gary?
Yeah, I'd love to get your comment on this idea that there are still folks who are operating as if nothing's wrong.
Yeah, I could not agree with the mayor more. He's pretty much put it in perspective. The bottom line is, as he said, the city is pretty limited in what they can do other than to encourage. But major parties and times together yield negative results right now when no protocols are actually followed. So what can be done? I'm going to give that back to the mayor since I left his employ. But I agree with him.
I think we got that. I'm just trying to thumb through some of these questions. This is for Claudia Blackburn. What percentage of the vaccine that has been shipped into Leon County has ended up with people? I'm not sure I completely understand. It's ended up with people, and what percentage of the vaccine expired before it made it into someone else's arm? You're pretty much getting the doses you get into arms, correct?
We are. We haven't had any vaccine expire. Our goal is get it in and get it into arms within a week. And we're pretty much accomplishing that as a community.
Quickly for Janae and for Temple, are you comfortable that you are getting the resources you need to take care of the populations that are available to you now?
No, I'm not comfortable. The need is great. We have manpower needs, and you don't have to be a clinician to necessarily be of service. There's so much paperwork and documentation that has to go along with vaccinating. We need vaccine. We need help with getting schedules together. We need more PSA time at the right stations so that we can get the word out. We need more health educators and outreach. And I'll stop and pass the baton to Janae because we're singing the same song.
Definitely. Everything Dr. Robinson said is what we're the things we're facing over here at Neighborhood. I will make a plea, and Gary, you know how I feel about PSAs. It's definitely time for PSA in this community with these faces that you see on this call today, especially when it comes to Dr. Robinson and I. Our patients know us. Our patients know the providers that we have here at Neighborhood and Bond, and they trust them. They trust them with everything that they have. And if they see us and they know that they can trust us, which they all do, they're more inclined to listen to the advice that we have and also take this vaccine. So we're definitely past time for a PSA. And I would love to see that happen for this area.
And it's not hard to do. I mean, when you go get your vaccine, it's a pretty smooth operation, Neighborhood and Bond. I mean, you guys have got it down pretty good. It is not there's not a lot of layers to go through. I mean, it's a pretty smooth operation, Temple.
Well, it's like those ducks you see. They look smooth across the water, and they're doing like this under the water.
Right.
And that's what we need. We need help to help us do like this. You know, the paperwork has to be in 24 hours. So if you vaccinate 200 or 300 people,
Right.
somebody, and the clinic isn't over until 6 at night. It doesn't matter if you're vaccinating on Saturday or Sunday, 24 hours, and it all has to match up. And a lot of these folk that are coming to be vaccinated are not our patients, so they're not in our electronic health record. And I could go on and on and on. So it's smooth sailing, and that's what we want for the people coming in to get their vaccine. We want them to leave impressed and awed, but we're working like a son of a gun trying to get this stuff done timely and correct.
Similar experience, Janae?
I'm sorry. That is definitely what happens. it takes a small army to make this happen every week. And we're trying to do vaccine clinics twice a week, in addition to our mission with our partnership through the Board of County Commissioners with testing on the weekends. I am definitely grateful to our staff. They have made so much happen with zero time. Like, I feel like we wake up and we're back here. It's like we're almost sleeping at neighborhood every day, but we're making it happen because it's for the greater good. So, you know, any additional resources that we can get, and it's a lot to that statement, because we're not a regular physician's office. We're a federally qualified health center. So there are other things that we're bound to do when it comes to taking volunteers. So that's something we could talk about offline, but there definitely is a need for additional resources.
And if I may, I don't know who's listening on the line. So we've had requests from various groups, maybe an assisted living facility, for instance. And if we say that we can't come right now, or we can't come, it is because of the army of people that it takes to set this up. So you have people that are doing the vaccinations, you have support team, you have IT. If you go to assisted living facility, there's no Wi-Fi. You're taking your own Wi-Fi. You're taking your own scanners and everything. It is a huge production. We have as many support staff as we do people actually giving the vaccine. And we must be prepared for emergencies. It has to be done right. You just don't show up and, as I say, start jugging people. And you know, there's a system behind all of this. So bear with us. We want to do it the right way when we come.
And not only a system, Dr. Robinson, I'm sorry, Gary. I want to point out, I know I've talked to Claudia about this too, the logistics of pulling this off on a daily basis, not just, okay, we have the vaccine, we can put it in your arm. No, there's parking. There's watching people after we give them the vaccine. There are people who are coming to us, which we see, we're used to this. This is our norm, who need help completing the paperwork, who aren't clear on what these questions are, who we have to sit down and break this form down. It may seem like a one-pager to everybody and as simple as pie, but it's not. We're helping people complete this paperwork on a daily basis. So imagine the manpower, in addition to the compassion and the empathy that it takes to go into this process, because the end goal is the same for all of us, but the path to get there is definitely not the same.
Thank you for that. We just got about 2 minutes left here, and there's one statistic that is really interesting, I think, to everybody listening, that Leon County is ahead of every other county in Florida with regard to getting vaccine to the population over 65. So even with all these challenges, the group of people you see on the screen in this webinar are doing a remarkable job. And Claudia, we'll finish with you. That has got to make you feel pretty good that, as you and I talked before, you guys are building this plane on the runway. The work of the hospitals in this community has been remarkable, and the work of the clinics has been remarkable to be taking the lead in the state in an issue that is this critical, to have these percentages happening. Just kind of put a bow around that for us.
Yeah, I mean, it's a great feeling. I can't say enough about the work of my staff and all of the partnerships here. I think we've just been really blessed to have stable leadership, that we talk to each other all day and all night, it seems, 7 days a week. And we work through a multitude of problems that are complex on a daily basis with the goal in mind. And that is, let's end this pandemic. We're sick of it. But I just want to say one thing, Gary, I know we need to go. We all need staff, and we are hiring at the health department, people that can also help the bond and neighborhood. We need people that are flexible, that are smart, that can work long and hard hours. And if you're out there and you want to work part-time for us, which might be full-time, give me a call, send me an email. Thank you.
That's great. Thank you. And thank all of you, really, not only for this, for the great work you do. And Kevin, thank you for the information that you put out there. That is valuable information for folks, and it'll be available. Remember, everything you heard today you can see at tmh.org/coronavirus. The folks there have been doing a remarkable job of getting this information out. And thanks to all of you for spending your lunch with us on this really important issue, especially the focus today on the African-American community. And we will see you guys next week. Skip will be back right where I'm sitting. And to everybody, have a safe and healthy week.